The ABC15 investigators are asking why some National Guard members are in a battle for benefits with the Department of Defense. Senior investigator Melissa Blasius continues her reporting on men and women seeking medical care after getting sick or hurt while serving our country.
Yeah, tonight, the long-term impacts of delays or denials.
When members of the military sign up to serve the United States of America, we guarantee them that the government will take care of them when they are injured in the line of duty. And the U.S. government is failing to do that.
Jeremy Sorensen's with the nonprofit group called USJAG, which advocates for injured service members like Arizona Air National Guard pilot Christine Kjornes.
Because in the Air National Guard, anytime that you have an injury, an illness, or disease, and you're serving in an active duty capacity, it has to be documented, otherwise it's like it never happened.
Major Kjornes told her story to the ABC15 investigators, how doctors diagnosed her with an in-the-line-of-duty illness at an officer's training school in Alabama. It was documented here saying her condition was service-connected, but the form was rejected for a clerical error back in Phoenix at the 101st Air Refueling Wing. After more doctors and a new form, Kjornes' own commander recommended an in-the-line-of-duty determination. But up the chain of command at the National Guard Bureau, it was reversed as not in the line of duty.
I was just shocked. I was absolutely dumbfounded as to how and why and where did this all go wrong.
As a result, Major Kjornes, already grounded due to her medical issues, was also denied military pay and health care benefits. She appealed.
It's been 2.5 years of fighting a David and Goliath situation.
In the end, the Air Force Board for Correction of Military Records ruled in her favor, restoring her pay and benefits.
I won. I was able to get this overturned.
But that's extremely rare. Take a look here. In a 6-month period, wing commanders had approved 949 cases as in the line of duty. Their recommendations sent up to the National Guard Bureau, who found 292 of those to be actually not in the line of duty. That is a 30% denial rate. Of all those, only 6 appeals a year makes it all the way up to the Air Force Board for Correction of Military Records. And of those appeals, get this, folks, just 1 to 2 airmen a year actually wins their appeal. Why? Many National Guard members give up after the first denial. That can take an emotional toll.
And by the end of it, feel like they've had their back turned on and that they're fighting against the system. No one's there to help them.
Attorney Allison Weber handles dozens of cases for Guard members and reservists who say that they were improperly denied medical benefits. Weber says these denials can end military careers.
They keep getting told they have a not line of duty condition and they're returned. And a lot of times they're pushed out in some other way. They may just be denied the ability to reenlist. They could be deemed, I've seen some where it says that they're unsuited.
Being discharged as unsuited for military service instead of for a medical disability.
Do cases like this have a chilling effect on other service members, reservists, Guard members?
They absolutely do. You can imagine that nobody that wants to continue their military career wants to come forward and say, I got hurt, if they're going to be turned on by leadership.
Last year, the Government Accountability Office urged the Department of Defense to do more to ensure service-related injuries and illnesses are properly reported and documented for National Guard members and reservists. That's because the GAO found a 16 percentage point gap in VA disability approval rates compared to active duty service members, which means National Guard members and reservists are more often denied monthly veteran disability checks and VA medical care.
In the end, we're talking about long-term benefits that can be hundreds of thousands or millions of dollars.
Absolutely. To me, there's no question. Ethically, morally, it's the only thing we can do as a nation is to take care of our injured service members.
The National Guard Bureau says overall their processes and systems are consistent with the law, DoD policy, and Air Force regulatory guidance. It's not entirely clear, though, why 30% of the line of duty cases were denied after they got that preliminary approval at the state level. I'm investigator Melissa Blasius, ABC 15, Arizona.